Hello, young people in this very interesting meeting of the Baltic Sea region young leaders. I'm sorry I can't be with you personally. We're looking at something that's pertinent, I think, to the entire globe. And I'm really happy that I have this opportunity to talk to you about the Agenda 2030 of the United Nations. My focus is on compounded inequities and how we can tackle them, and how everything in a nutshell has gotten even worse now with the COVID-19 pandemic. My name is Gabriele Kohler. I actually have a connection with Latvia because I, at one point, was the UN resident coordinator in Latvia, and I used to work with the United Nations for a long time. I am now with the UN Research Institute for Social Development as an associated researcher. And I also work with Women Engaged for a Common Future, which is a gender and climate change oriented NGO. I'd like to thank Janette Ojelina and Zikita Struberger for this invitation, and Christoph Selmins for doing the recording. So, COVID-19 and the 2030 agenda. I have 5 points I'd like to run through: the agenda itself and also the history a bit behind it, so we understand a bit more the context. I'd like to dive into a few of the SDGs, the Sustainable Development Goals, more closely to give you an idea of what they're about and how we're lagging behind even before there was the pandemic. Then turn to the COVID itself and how it impacts on the agenda. Some of the responses that we've seen in 2020, early 2021. And then, of course, as a UN person, I'm going to make a big pitch for reinforcing multilateralism. So if we look at this 2030 agenda on transforming our world, where did it come from? In the year 2000, so a long time ago, the United Nations adopted or convened a Millennium Summit at which it talked about Millennium Goals, which were basically sort of a combination of different UN summits that had taken place during the 1990s, as well as action that had taken place at the OECD to come up with development indicators. At that point in time, development was really conceived as a North-South thing, the South, the global South, having to develop, catch up with the North, and the North being okay. And we'll see how this changed with the Sustainable Development Agenda later. But just quickly on the MDGs, the Millennium Declaration Goals, Millennium Development Goals, it's a gradualist approach. It was about reduction of poverty, hunger, unemployment, as opposed to actually eradicating it. There was a big focus on the global South. It was a big focus only on social development, not very much on economic development. It came up with time-bound targets leading up to 2015, the end year. And it's a member states, United Nations member states commitment, but not binding. These 8 goals had 18 targets, sub-goals, and 48 technical indicators. So at that point seen as to be very complex. We'll see how the Sustainable Development Goals are actually much more complex. Parallel to this process around development agendas, the Millennium Goals and other previous agendas, at the UN there was also a track looking at climate issues. The first big climate conference was in 1972, even longer ago than the Millennium Summit, a summit on the Earth. And in 1992, again, an Earth Summit. And this Earth Summit adopted the UN Framework Convention on Climate Change in 1992, which has annual conferences. The next one, in fact, is in Scotland in the autumn of this year. So we have this process of Millennium Social Development Goals, if you will, and climate goals. As 2015 was approaching the targeted end of the Millennium Declaration and its MDGs, the delegates of the United Nations system, as well as civil society, started thinking about what can we do to continue the MDGs, which were not being achieved, which were not being met. Does one want to do a continuation of the same, or does one want to do something new? And the decision was a good one insofar as one decided to pull together this climate change track with the social development track. And the result was this declaration or document, Transforming Our World, the 2030 Agenda for Sustainable Development. So it's sustainable both in the climate sense, but also in the social and economic sense. And it took the form of a UN resolution. This Sustainable Development Agenda has 17 goals, so far more than the previous Millennium Declaration, and very many sub-targets, 169 sub-goals or targets, and they are measured with 220 indicators to see how is the progress going. And each year, 5, 6, 7, 8, 9 countries report to a high-level forum of the United Nations to see how are they doing on achieving the goals to which they had committed. Here we see the goals listed out, and here we see how many targets each of them have, and we see the indicators, 169 indicators, and what we also see is that some of the goals were already meant to be met by last year, 2020. Some are scheduled for 2025 and the rest for 2030. Again, parallel to the SDGs and the Sustainable Development Agenda, we have the Paris Agreement regarding climate, which was adopted in parallel, so to speak, in the same year, 2015, with a commitment to limit temperature rise to, I think now we're very much on the 1.5 degree warming. This is compared to pre-industrial levels. It's based on nationally determined contributions, meaning each country determining how much it will contribute to this reduction in the temperature, in the CO2 emissions. And it's a binding agreement once a country has ratified it. So let's look a bit more at the SDGs, at the Agenda 2030. It contains and surpasses the MDG list, so it has some of the social development criteria, as it were, the poverty, the hunger, the education, the health in it. But beyond that, it brings together this environmental, the Rio processes, and the MDGs. It's very much more rights-based. It refers to the Universal Declaration of Human Rights, which was adopted in 1948. It is universal, so we've moved away from an agenda of the United Nations addressing the lower income countries and saying this applies to all countries, and the implication of that is that all countries are in processes of development, including, for instance, the Baltic countries that you come from. Poverty is seen as something multidimensional, so it is cast in income poverty, but also in other indicators of poverty, such as access to health and education. Gender is a bit more spelled out, gender equality and empowerment. There's a very strong focus with an actual independent sustainable development goal on inequality, which is a topic which I think is at the heart of all of our concerns around development. This coming together of the environmental concerns and the social and the economic concerns is expressed in a goal around sustainable consumption and production. We have 4 SDGs specifically addressing climate change. We have an interesting new type of thinking going back to older notions from the 1960s and 1970s around an industrial strategy. How do countries actually transform? Social protection is spelled out strongly, and health also has a number of goals and targets, sub-goals and targets. But there are some synergies and contradictions, because we have, for instance, decent work is one of the goals, and which would of course contribute to decreasing poverty. But at the same time, if decent work is coupled, as it is in SDG 8, with economic growth, we do have a contradiction, a clash, a problem regarding climate change objectives, because basically any kind of economic growth is always resource intense to some degree. Plus the contradiction or problem of the SDGs of this Agenda 2030 is that it is not binding. So contrary to the climate agreement of Paris, which is, as I mentioned, binding, this is not binding. So we don't really have enough traction to really get things to change. Let's then move into a bit of a close-up, looking at individual SDGs, some of them a bit more closely to see where we're at. For instance, goal number 1, no poverty. Eradicate extreme poverty for all people, measured as $1.90 per person per day. This is, of course, in purchasing power parity, which means it's adjusted to the real cost of living expenses of each country. Reduce at least by half the proportion of men, women, children living in poverty in all its dimensions. And this is said according to national dimensions. There's always a big fight in the UN conferences. Do we measure poverty, but with an international poverty line like this $1.90 a day, which is adjusted, but still it's like a global norm? Or do we take a national poverty line, which would put into the basket of how we measure poverty the national typical consumption expenditures for education, for transportation, for health, etc.? And importantly, in this no poverty goal, there's a strong expression of commitment to social protection systems. But what is the real picture? Between 1990 and 2015, so up to the date of adoption of the Sustainable Development Agenda, we see that poverty was not really decreasing. We see here a $5.50 measure instead of the $1.90 because it's a bit more realistic. And here we see that the number of people living in this $5.50 type of poverty actually increased or stayed stable, did not decrease between 1990 and 2015, with basically 3 billion people living in poverty. Or if we take the $1.90, but take out China, we do see a decrease in poverty, but $1.90 as a poverty measure is a very, very extremely low indicator, so it's a question. And China, of course, is mentioned because China is the only country in the world where poverty in income, measured in income indicator, actually did decrease. So this is from a report that the UN Secretary General issued in 2019, looking at, this was before COVID, remember, in 2019, looking at where the countries were doing 4 years after the adoption of the Sustainable Development Agenda and poverty in all its forms. Goal 1, the world was not on track even before COVID. If one again takes 1990 to 2030, if one really wants to have poverty eradicated by 2030, it would have to be 0 here. And even before COVID, it was not on track and the decreases were too little. And here you see 700 million people living in extreme poverty. And as we saw, if we take a more realistic poverty number, it's even 3 billion people. The social protection measured, I mentioned in this SDG number 1, we see why it is so important. In many countries of the world, social protection coverage, so this is access to health insurance, accident insurance, unemployment benefits if one loses one's occupation, pensions. In the global south, the coverage is very low. In sub-Saharan Africa or in Africa as a whole, below 20%, in Asia and the Pacific, below 40%, in Latin America and the Caribbean, below 60%. And if we take a global figure, only 70%, less than 70% of the world population, 70% of the world population are not covered even by one form of social protection. So that's why it's such an important goal for the SDGs. Food security, the same thing. It, of course, mirrors income poverty, very high food insecurity, basically hunger or malnutrition in the African continent, less explicit, but also strong in Asia and Latin America. So a lot needs to be done. If we move on to goal 5 around gender equality, one big issue is, of course, the issue of care. It comes out very strongly in the Sustainable Development Agenda. The reason being that on average, women do 3 times as much unpaid care, caring for the family, caring for family members who are not well, caring for children, doing domestic chores. And because of doing this, fetching water, because of doing this type of unpaid work and domestic work, women are very disadvantaged in the formal economy. And there's, as I'm sure all of you know, a huge gender pay gap. This is just an example from the Chiapas region in Mexico, women on their way to fetching water from a faraway water source. Every year, I don't know whether we're aware of this enough, 300,000 women die in childbirth. We're now very much attuned to the COVID figures, which we see every day on our various screens, but 5 million children die every year of preventable infant diseases, children under 5 million every year, and 300,000 women die in childbirth, which again, in situations, most of which would be preventable deaths. So we have a huge gender inequity and health challenge as well. Moving to goal 8 around decent work and economic growth. So it's about economic growth. It's the first one in the list, which is why many people who are into the post-growth kind of discourse are very concerned with this particular SDG. Then it's about promoting productive activities, decent job creation, entrepreneurship, creativity, SMEs, looking at financial services, and then achieving full and productive employment by 2030 for all men and women with equal pay for equal work. So it's a very mixed goal if you look at it from sort of the contradictions between climate, commitments to climate, to stopping climate change, and to having social justice and economic justice. Another figure here, people in vulnerable employment are often called informal employment. It's especially high in Southern Asia, with 80% of people working in employment conditions where there's no contract, where there's no predictability, where it's daily wages, where it's no social protection, where there's a very strong power hierarchy in the working relationship, and equally marked in sub-Saharan Africa, and even in Southeastern Asia and the Pacific, where we tend to see these Asian tiger economies, we see a very high level of informality or vulnerable employment. And we see that in the lower income countries in the global South, women are more affected, and interestingly in the global North, men are more affected in terms of being in vulnerable employment. 2 examples of extremely exploitative work, one from Rana Plaza in Bangladesh. I'm sure you're all aware. In fact, it'll be a 7th anniversary of this sad event tomorrow. The Rana Plaza was a factory building with textile workers, garment workers in it, which collapsed, and at least 1,000 people died, and many more were injured. And none of these women, mainly women workers, and men, had any social protection, no social insurance. So the surviving family members were without any source of income after that. Equally tragically, something similar happened in Latvia, a developed country. In Riga, a shopping center collapsed, part of a shopping center collapsed. And similar to here in Rana Plaza, where the workers were not allowed to leave, I read in newspaper reports that also in this Maxima shop, in this shopping center, workers were told to clear the stock before they left the building, and also people perished. So these are work conditions that are vulnerable to the extreme. If we look at SDG 10, which is to me the core of all of the SDGs, it's about reducing inequalities. Just as one way of looking at inequality, the Gini coefficient of income inequality, if it were 0, we would have no income inequality. If it were 100 or 1, depending on how you count, it would mean extreme inequality. We see a lot of countries in the global South with very high income inequality, whereas here we have a positive trend in the global North, especially in Europe, where through taxation and social transfers, income inequality is fairly good. Below 0.3 or below 30 is considered fairly equal societies in terms of income. To make this a bit more drastic, Oxfam produced this poster that 8 billionaires own the same wealth as the poorest 3.6 billion people on this planet. And so just to illustrate that, they said, these 8 billionaires would fit into one of these golf carts. Just to show the immense inequality in incomes or in wealth in this particular case. If we look at one of the climate-related SDGs, it's number 13 is about resilience and capacity to adapt to hazards that are related to natural disasters and to climate change. Put climate change measures into national policies. This is a bit of pointer in direction of the Paris Agreement, because as I mentioned, the SDGs are not obligatory, they're not binding. So one had to make this reference, this strong reference to the binding agreement under the UN Framework Convention, and implement a convention, this is often forgotten, to have 100 billion annually coming from the global north to the global south, which needs to do much more to catch up on climate change, adaptation, and mitigation. Again, to show the inequalities, this is our global material footprint, how many resources each of us as individuals and each of our countries pull out of the planet. And we can see, first of all, it's exploding, this exploitation of the planet, and it's much higher in middle-income countries than in low-income countries, illustrated more starkly here with carbon inequalities. The richest 10% of the global population, this is not by countries, but by income quintiles or income deciles, the richest 10% of the world population are responsible for almost half, basically half, 50% of total lifestyle consumption emissions. And it's sort of sarcastically put into this champagne glass illustration to show, the inequality in terms of carbon emissions and consumption emissions. And finally, I'd like to quickly look at goal 16 around peace, justice, and strong institutions. Reduce all forms of violence and death rates that related to them due to the violence, promote the rule of law, and reduce illicit financial and arms flows. So how are we doing there? As everyone knows, political instability and violent conflicts have increased. Sadly, one was expecting a sort of peace dividend after 1990 when the Cold War was notionally ended, and one thought there would be more peaceful resolution of conflicts. It's not the case. This is a picture from Syria, and Mars and military expenditure is astronomical, and it dwarfs any kind of spending. This is spending on climate change mitigation and adaptation. So $1 trillion in 2000. At $1.6 trillion in 2015 for military expenditure. So somehow we have a certain explanation also for that inequality. So we see all these intersecting, overlapping, mutually reinforcing inequalities, economically vulnerable work, informal employment, no social protection, ecological inequities with the uneven distribution of climate, of impact on using the Earth's resources, gender inequities, and the different forms of social exclusion. So then comes COVID-19. So already we're seeing a very unequal world, global north, global south, and then within each of the countries, remember the Gini coefficient, the very unequal distribution of income and wealth. This is from 2 days ago, 142 million confirmed cases of COVID, 3 million deaths as of now, and 889 vaccines distributed. This is from a UN Department of Economic and Social Affairs report looking at the impact of the pandemic, the COVID-19 pandemic. The Agenda 2030 is even more off track. It deepens all the inequalities. And then we have this rhetoric about building back better. And I say it's a rhetoric, and I say it's disturbing or worrying, because we don't really want to go back to where we were, because we saw even before the pandemic, the world was deeply unequal, north, south, and within countries, between the genders, between social groups. So we don't really want to build back, we want to build forward and build something better. But here you see that for every single SDG, we have a direct impact of the pandemic because of lower incomes, because of more health impact and so forth. If we look at COVID-19, this pandemic, its impact, the direct ones obviously are on persons with vulnerable health conditions, old age people, senior citizens, but people also with pre-existing health problems, people working as health professionals, the key workers who are in jobs that can't do home office type of work, everyone who is marginalized, and people facing under-equipped health systems. That's sort of the direct effect of a pandemic, basically on the health level. The secondary effect, as we all know, are even more pernicious. We have all these precarious workers, 2.7 billion people work in vulnerable work in the informal economy. We have the migrant workers who in many countries, both in the European EU countries as also in the global south, were suddenly sent home. So they were no longer receiving their meager incomes, and that also meant they were not able to send remittances to their families. A lot of people affected are those who live in underserved communities and in very dense housing, so people on low incomes, such as asylum seekers, prisoners, people from socially excluded, socially disadvantaged communities, prisoners, and then of course providers of unpaid care. And as we saw, this is mainly women. Violence against women has increased. Children are affected both in terms of the health effect, but if their parents or grandparents are affected, but also in terms of the secondary effects, and people who live in weak welfare states in countries where the government is not in a position to provide support. Two examples from very different countries, and this brings home a bit the point that we're all living in developing countries. No country is really in a status of being developed, in quotation marks. This is from New York, from a community in the city of New York that's very disadvantaged, where very many people, proportionally more people, fell ill too and died of COVID than in other parts of Manhattan and than in Manhattan, other parts of New York. And this is a picture from Delhi, where you will have read that it has the highest rate of new COVID cases of anywhere in the world, and where oxygen and therapeutic measures are no longer available for people, and especially harmful, of course, again, for the poorest people who cannot even afford to buy this kind of an oxygen tank. This is from the United Kingdom. Office of National Statistics did a study and found that Black men were 4 times more likely to die from coronavirus than their white counterparts, and also higher vulnerability to the virus, according to other ethnic groups. Not many countries do these kind of disaggregated statistics by social groups. So it's valuable to have this from the United Kingdom. We're now getting some similar information from the US and from Germany, but I don't know about your countries. And this is about the EU countries. It's from the European Institute for Gender Equality Studies, which looked at the gendered impact of COVID, severe job losses in women-dominated professions. All of these data relate to the 27 EU countries. The work-life balance pressures have increased between the care work and the work in the economy, and inadequate support measures with domestic violence exploding because of lockdowns and people staying at home, and women who are in vulnerable, violent relationships being not having any resource to support by being able to go outside. So if we look at the direct and the secondary effects, basically we find that this inequality that was already there is compacted, is exacerbated, is deepened for people who are in vulnerable employment, who live in income poverty, who live in poor housing, who are discriminated because of their gender, because of age, and because of social exclusion. The drivers of these inequities are, of course, structural as well as acute. Now in the pandemic, we see sort of the inequality magnified because of the pandemic, direct and indirect effects, but also in situations of armed conflict, in situations of migrants, asylum seeking, etc. But at the same time, we have the underlying constant what has been called structural violence, where income poverty, hunger, lack of decent work constantly reinforce poverty and very difficult situations, lack of access to to health resources, to education, to technology, and then all of that increased now by the impacts of climate change. So what has been happening? What have been some responses, policy responses by governments to this pandemic? I mentioned before the numbers. Here we see who will get the vaccines, and we see the green areas are the countries that are doing very well or fairly well on vaccinations, including the Baltic Sea countries. And the countries that are doing very, very poorly because they don't have access to the vaccine. We see a lot of critique of the vaccine nationalism, with the rich countries not being willing to give up the patent on the COVID vaccines so that the production could be ramped up and everybody in the world could quickly be inoculated. We also see an unbalanced policy reaction in terms of how much money is available to spend. And there's a big imbalance again, North and South, global North, global South, with the rich nations spending much more, by orders of magnitude on recovery, the Building Back Better kind of programs, economic recovery programs, help to businesses in particular, but also social transfers. And if we do it per person, 28 rich countries spent on average almost $700 per person. This is in 2020, whereas middle income and low income countries only between $4 and $28, so a fraction. This is based on a study of those 60, 70 countries, but it's quite indicative of the global picture. So huge imbalance in terms of how much is actually available in a country, in a welfare state, or a not welfare state to address such a crisis. One thing we saw in 2020 was a surge in social protection. So remember, very low social protection in the regions of the global South. But between February and October of last year, we see almost like an explosion of social transfers in terms of adding to existing child benefits, old age benefits, but also introducing new benefits to people who fell into unemployment or some kind of health insurance transfers. So we see in that short period of time 1,500 new social transfers. So everybody in the social transfer community, as it were, the social protection community, was very happy because we thought this crisis at least has one positive side effect of ramping up what governments do for people living in poverty and hunger. But what we then actually saw that all of these social transfer amounts are actually very small. They're limited in time. The informal economy, so the working age group between 15 and say 65, remains largely uncovered. And one NGO did a survey of who was actually reached, and many people who were interviewed actually said that they hadn't received any of these cash transfers. So we don't know how much of that surge, which of course is a good thing, how much of that surge actually reached the people for which it was intended, and how much is just reporting to the World Bank, to the ILO on doing something in the crisis. So to come to my final point, the case for multilateralism. Multilateralism, basically, as a UN person, I think the UN is the place, the agent, the agency where social change, social justice, economic justice, and climate justice needs to come together, because that's what was decided when the UN was created. To overcome these compounded, exacerbated inequities that we've seen, we need policies for decent work. We need universal social protection, which is not conditioned on any type of good behavior. We need a lot of policies for social inclusion, both for gender and for socially excluded minorities. We need decisive action to halt climate change. We need much better health systems that have the capacity for surge. I don't know about other countries. In Germany, there's been a big movement to dismantle hospital beds, to dismantle hospital staff, and to have just enough hospital capacity for normal conditions. And when this pandemic happened, many hospitals realized that they just didn't have capacity to deal with the pandemic. And this is in a rich country. And so, of course, we know in low-income countries, this was much more stark. And to get this, we need good politics. We need parliaments that really function. And we need a very, very strong civil society that knows what the rights are, that knows, for instance, what was committed in the 2030 agenda and can claim these rights and monitor these rights. We need justice and global policy to be coherent, fighting for justice, claiming justice, both within countries and between countries. And I would say we need something like an eco-social, economic, social, ecological contract to address both the climate crisis and the social injustice, remembering that what was good about the SDGs, about the 2030 agenda, was bringing together the climate and the social and economic justice strands of UN work, bringing that together. And that would also need to come together in something like an ecological, economic, social contract. So maybe it should be eco-social contract. Just to remind you of the Universal Declaration of Human Rights, as someone who's a multilateralist and a supporter of the UN ideas, with all weaknesses, which we could discuss separately, of the UN system, of the multilateral system, the Universal Declaration of Human Rights is really what is driving this notion of economic, social, and climate justice, as we know was adopted in 1948 and is still undelivered in most countries. So to be a bit more specific, what would be required policy responses? At the national level, we now need expansive fiscal policy. I say that because in 2020, very many governments actually went out on a limb and went into deficit spending. There's a big risk that in 2021, 2022, this will be rolled back because governments will feel they need to go back to austerity measures. The paper actually that just came out that most countries are already contemplating going back to austerity. We really need to maintain expansive fiscal policy, fiscal spending, to keep up the momentum of helping overcome the pandemic effects and overcoming the inequality. We need to ring fence, we need to protect social expenditures. That's another risk that one might say, okay, we'll protect businesses, but we'll do away or we'll decrease spending on health and education. We need to have guarantees in every country of decent work for all and raise the wages, especially in the key work segments. We need to close the gender wage gaps and sort of the lifetime gaps in earnings of women and other disadvantaged groups. We have to universalize social protection, and we have to adopt really fierce regulation on CO2, on the emissions, and also on biodiversity. So this is what I feel needs to happen at the national level. But here we're talking also about multilateralism. And so I think we need a binding treaty on business and human rights. We have guiding principles on business and human rights, but again, they're not binding. They were adopted 10 years ago in the UN system. Many countries notionally adhere to these guidelines, which are about business is not violating human rights, environmental rights, women's rights, health rights. But in reality, very, very many companies do not comply with their promises. And so what we need is a binding treaty, which is actually under negotiation at the UN Human Rights Council. Next meeting is in October, and anyone who is a human rights interested person, please follow up with me. I'm very involved in that process. We need a transnational framework on care work because we have a lot of migrant streams of women and socially disadvantaged groups moving to one step higher income earning possibilities from one location or one country to the next. We need to have this unified so that there's an equalizer in terms of payment conditions so people don't have to migrate. We need to have an ILO convention on home-based work so people who work in global supply chains are really paid properly and have social protection. With regard now to the pandemic, I already mentioned that there is this is from the World Trade Organization, the agreement on intellectual property rights, on the intellectual property system. We need an agreement that vaccines and therapies in pandemics don't have a patent on them. The patent is waived, so that production can be increased. We need this funding that you saw in SDG 13, the funding for climate change, to really happen. It's not happening at all. We need agreements on debt rescheduling in low-income countries. We need a unified international taxation system. The US has just proposed something in that direction to come away from this tax competition amongst countries, which is a race to the bottom, instead of saying all countries, in order to finance more equity, more climate justice, more social justice, need to be welfare states that have a proper level of income at the government level to then do their job, as it were. And we need also something like a transnational fund for social protection. Coming back to the 2030 agenda to close my talk, I had shown you these many targets and indicators, and I had mentioned that countries meet to report on their progress. The next meeting on the SDGs is in July. It's this high-level political forum. And from the Baltic Sea region, we have several countries reporting. So if you're interested in what your country is saying, you can go to the UN website on this high-level political forum and look up your country's report. Most countries have the government submitting one report tracking performance on the SDGs, and have a parallel report submitted by civil society. Very few countries actually have one combined report from civil society and the government. I think Austria did that last year. Anyway, very important process if we want to get more oomph into the SDGs, because they're not binding, so that countries really live up to their commitments. Here are some databases that you might want to look at and some papers related to this particular topic. Of course, I saw somewhere that in 2020, some 20,000 papers were published on COVID and economic social policy and responses. So a lot more to be read and researched. This is something on social inclusion, which might interest you. And do feel free to contact me. Here are my contacts. And again, thank you to Christops for his patience. And I'd be very happy for any feedback you might be able to give. Thank you so much.